Treatment protocol. A. Preparation before the patient scanning. We saw earlier that comparing the length of both legs is the key element of the scanning and diagnosis method that is used during a biomagnetism session. When shortening or elongation is several centimeters, it is quite evident to the eye of the therapist. Unfortunately, the difference in length is often small. Therefore, the therapist should have experience and accuracy in determining if the right leg has changed or not its length with respect to the left one while placing a magnet on a specific point. To be precise, the therapist must have a clear reference how were the two legs before putting the magnet. And then, from this clear reference, he will be able to compare future shortenings or elongations that reveal acidic or alkaline points. This initial reference is very important because, again, the variation in length of the right leg is often small. In order to obtain this clear initial reference, the patient should be lying face up on the couch where the therapy session will take place. It is better that the patient keeps his shoes on. It will thus be easier to compare the length of both legs, looking at the patient's heels or shoe ends than looking at his bare feet. If the patient comes to the consulting room with sandals, then the therapist can use masking tape to fix firmly the sole of the sandal to the foot of the patient, so that both form a unit and do not move separately. The patient's feet should hang a few inches from the end of the couch, heels hanging in the air. Thus, the therapist can easily grab with his hands the patient's ankles. It is very important that the patient is straight and parallel on the couch. If the patient twists his spine, the result that the therapist obtains will be distorted, as a hip will be higher than the other, thus pulling from one leg more than from the other. In that case, the patient must adjust his hip and be completely straight, particularly overweight patients. The therapist should be at the patient's feet. He may be standing or sitting as he feels more comfortable. The patient's legs should be completely relaxed and loose. The therapist will grasp the patient's ankles, immobilizing an ankle in each hand. He should not hold the legs above the ankle so that the patient's feet do not swing freely. If a foot oscillates more than the other, then the therapist may get false positive results and misdiagnosis. When he grabs the ankles, the therapist must stick with his little finger the patient's heel to the sole of the shoe. The patient's heels should touch, but the toes can be opened. Next, the therapist will raise the patient's feet a few inches above the couch without pushing or stretching. The therapist must, in order to correctly compare the length of both legs, do some gentle but continuous rotational movement with his forearms making them swing from side to side, from supination to pronation, and vice versa. Thus, the patient's legs will have the opportunity to reflect their real length. If the patient's legs are heavy, the therapist may refrain from lifting them. In that case, he will perform these rotational movements while the legs simply lie on the table. This will be less tiring for the therapist. The therapist may even put a pillow under the patient's knees, but raising the patient's legs will help the therapist to better detect and compare any variation of their length. To compare the length of both legs, the therapist observes the patient's heels, or rather the union between the heels and soles of both shoes, as one of the heels could be more worn than the other. He can also compare both legs by looking at the tips of the shoes instead of the heels. In any case, it is important that a patient's ankle is not more rotated than the other. That is, the angle between the foot and the tibia of the patient must be identical in both feet. And it has to be so throughout the session. If the therapist is not careful and does not respect this, the diagnostic result will be distorted.